But leading off our sports segment tonight, the first of a two-part series on concussions. One neuropsychologist located in Lawrenceville has been studying the subject for years and recently met with us to delve into an area that's become more prevalent in the world of sports, really since the late 1990s. The statistics for concussions are downright alarming. 1 in every 5 high school football players in America sustains a concussion each year. 50% of collegiate athletes have had a personal history of concussion, and every year almost 20% of baseball and softball players sustain a concussion. Dr. Rosemarie Moser is the director of the RSM Psychology Center in Lawrenceville. She's the official neuropsychologist of the Trenton Titans and has studied the subject extensively since the 1980s.
When you have a concussion, it's not in any specific area. What you're doing is basically shaking everything up. Now, actually, if it's a hit, for example, if you were hit on this side, you could have what's called a contre-coup. That means here is the hit, but maybe this is the area of the brain that would be affected because it bangs against the skull.
Dr. Moser says that concussions have become increasingly prevalent in sports rhetoric since the late 1990s because of a shift in thought.
Because we know the phenomenon, we're identifying it more. I mean, just as in professional sports, if you watch professional sports now, you'll hear sports commentators mention who's had a concussion, who's back from a concussion, whereas many years ago, concussion wasn't even mentioned. So I think, first of all, there's more of an awareness, there's more identification of it. Before, we just said, oh, someone had their bell rung and never thought anything else about it.
With increased knowledge comes increased prevention. Over the years, baseline testing has been developed by neuropsychologists like Dr. Moser. The 30-minute computer test measures brain functions like reaction time, memory, and visual processing, and has been utilized by teams at the college level and has now been adopted by the NHL, NFL, and NASCAR, among other professional leagues.
If we have a sense of where an individual and how an individual's brain is working prior to an injury, then once they have an injury, we can retest them and see if their brain is still functioning in the same way.
Symptoms of a concussion include persistent headaches, slowness in thinking or acting, fatigue, and short-term memory loss. And once you've sustained a concussion, you're 4 to 6 times more likely to sustain another concussion, even after full recovery, and even if the hit is mild.
I think the most important thing is brain hygiene. That's what I call it. You know, dental hygiene, you take care of your teeth. Brain hygiene, you take care of your brain. Make sure that if you've shaken it up, you give it a rest before, and you're ready before you go back.
Dr. Moser said that there are a number of high schools in Mercer County that have already incorporated that baseline testing into their athletic programs, with more likely on the way. Tomorrow night, we'll have the second part of the series when the focus switches to children and concussions.